There are quite a lot of clinical trials that are looking into the impact of those cells in the central nervous system. So what I would say is that I think most of those clinical trials end up concluded that those cells are safe. I guess I would think that it's more specifically the case for mesenchymal stem cells and for eventually adult neural stem cells. I think embryonic and iPS are a little bit more touchy because we don't have a lot of perspective on those, and they have more potential to be teratogenic. So, but for me, mesenchymal stem cells and neural stem cells, adult neural stem cells are probably safe. I would say that the bottleneck is the production, because you need to produce a lot of those cells, and obviously they can contaminate easily, and they can derive too. So you have to be really super careful when you grow them, and it's specifically challenging when you want a lot of them. So for me, that's the first challenge. You also have, as a second challenge, all the logistic of delivering it from the factory to the patient. Because I don't think like every hospital is going to be able to host a lab where they will be producing tons of cells. And you will have to transfer them from the company to the hospital, whereas they don't necessarily have the possibility to handle frozen cells where they want them ready to use. So for me, that's a challenge. And up to now, one of the other last challenge is that it's still not clear whether they are that efficient. So that there are several challenges. Also the fact that there are a lot of discussion between using allogenic versus autogenic cells. Personally, I'm more convinced about allogenic cells because from a practical point of view, it's more feasible. If you want a lot of cells ready for a patient without him or her having to wait 3 months to get the sufficient amount of his cells or her cells. And also, if you are sick or with like a chronic pathology, for instance, I don't think your cells will be as fit, I would say, or as efficient as if they would come from a healthy person. So what we are working on in the lab, because that's also one challenge, is how the cells survive when you inject them. I think that's one of the reasons why they are not as efficient as hoped, because the engraftment is low and the survival is low. So the thing we are working on is a delivery system for the cells, where we will try to improve first the engraftment, their survival, and the fact also that they are locally injected, not systemically, because for me that's more delicate and you have higher risk of unwanted effect. So we really are working on improving that point. As a university, we are not really qualified, I think, to work on the industrial part and another logistic part, but we can bring improvement, I think, on delivery.